My name's Brian Dorries. I'm the Artistic Director of Theater of War Productions, and we're so delighted to be with you here at Harlem Hospital today.
I know that there are still some people here that believe that I did the right thing. And I ask you, what divine law did I transgress?
Theater of War Productions is a social impact company that uses theater and a variety of other media to help communities address pressing issues of public health and social justice. We've been around for more than 15 years, and all of our projects take the same basic structure: a reading or a performance of a seminal text that serves as a catalyst for a discussion in a community that wouldn't have happened otherwise.
Somebody was going through all this trauma. Nobody was there to console her. That should not be the case. As we all are here, look around to see all your colleagues. Many people are going through tremendous things which you may not know. Are you there to support them?
We present Greek tragedies and other texts that have extreme emotions to kind of move the walls of the room back and to say to those who have experienced those extremities of life and death, it's okay to talk about it here.
But the humble man who keeps his head down remains alive by riding out the storm.
Finding that sort of environment where you can speak and discuss what you really felt in a safe environment, that has honestly never happened to me before. Discussing nursing and people actually listening and hearing what you have to say.
For me, Antigone, what she did was create change. And it wasn't just, it was going against the grain, but other people saw this is right. And sometimes it takes one person to bring a whole floodgate open. So I appreciated that.
And so when that first person speaks up, it gives permission to all the other people in the room. The long-term impact of the nurse Antigone is in its ability to find the quietest person in the crowd and empower them to speak up.
We need to get together. We need to change. We need to change so we can progress here.
The Illumination Fund was so impressed by the impact that Theater of War had on communities across New York City. It's a very unique approach, and we decided to support 3 additional projects.
The 3 other projects the Laurie M. Tisch Illumination Fund has made possible for us over the last few years include the King Lear Project, in which we presented readings of Shakespeare's King Lear to frame conversations about aging and elder care and elder abuse. The Suppliants Project, which is a project that uses Aeschylus's play The Suppliants about 50 women seeking asylum at a border from forced marriage and sexual violence from their cousins, and we use that to frame conversations about the challenges faced by immigrants and refugees. And then most recently, Theater of War Frontline, which is a project we stood up during the pandemic to help frontline medical professionals who were in the thick of things during the height of COVID.
We will not cure evil with evil, for if we try, the pain will only grow, worse than the illness that brought it upon you.
There was a lot of anger and confusion. And if the ancients had anger and confusion in their times of plague, then this is not a new thing, which means I'm not alone in feeling this. And what I discovered during the Theater of War event, not only this message, but I also discovered there's a community there.
The thing that struck out to me most was when, in the Women of Trachis, Heracles mentioned to his son, do this without emotion.
Yes.
I think it's difficult for us as healthcare workers to do that kind of thing, because in general, we usually pride ourselves on being emotional people who connect with others and wish to take care of them.
It's been an absolute honor. I want to thank the actors and the panelists and our chorus with one big round of applause. Thank Dominic, my partner here, and facilitation. And of course, Harlem Hospital and the Laurie M. Tisch Illumination Fund for inviting us. It's been a great privilege. See you at the next one.